Hey there, happy Friday. My name is Julie Hirschberg, the owner, founder of Reactive Therapy and Wellness here in Los Angeles, and joining you again on a Friday around lunchtime to talk about what we've been doing this week, what we've been learning. And this week, the theme has definitely been in the concussion world. We see a lot of people here who maybe have had a concussion or a brain injury, maybe have prolonged symptoms. And this is a definite area where physical therapists, occupational therapists can be really challenged to narrow down and focus a treatment plan and even know where to get started. And this week, earlier in the week on Wednesday, I joined in our Instagram community for live to talk about how we manage that, particularly how we manage understanding all those complex pieces, putting them together, and working as an interdisciplinary team. And I wanted to go a little bit deeper into that today and answer another question, which I really want to hear from you too, is are persistent post-concussion symptoms, are those a functional neurologic disorder? And I think there are many arguments in both directions of that. So we're going to talk persistent post-concussion symptoms. We're going to talk about our pie chart that we just developed this week for that, and then talk about the similarities, the differences with functional neurologic disorder. So I think first it's important to define what we mean by persistent post-concussion symptoms. This has also been called post-concussion syndrome, or PCS, or PPCS, which is persistent post-concussion symptoms. More and more these days, people are using the latter term, the PPCS, as it looks to be like such a range of symptoms versus a syndrome. And, if you look at the consensus statements and things like that, they have very specific kind of criteria of like, these are things that are lasting beyond a time frame. So beyond 10 to 14 days in adults is when most people recover, beyond 4 weeks in kids and adolescents. However, more and more is coming out that there are subtle changes in the nervous system that last much longer than that, at least a month in a typical concussion. So when symptoms persist, we would say beyond that time, beyond a month, 2 months, 3 months is really what we're looking at. So when we say persistent post-concussion symptoms, we're talking about those not that just occur right after, but may be prolonged. And I know for me, for our team, what we typically see, unfortunately, we've been seeing more and more people where it's closer to the time of the concussion, but a lot of times we see people years later. And honestly, part of my mission is that that doesn't occur, that people can get the care and rehab that they need early on so that this is in a prolonged period. So that's what we're talking about. We're talking about symptoms that persist long after a mild traumatic brain injury. And there are very common symptoms that do persist. And those include, so this is the pie chart, by the way, so if you want to see it and have me talk through all of it, we did that on Wednesday in our video. And by the way, I put that visual and that video from Wednesday, the video from today, and all the articles and things that we're talking about today, the links, that's all in our newsletter that we send out every single Friday. So if you want to join that newsletter, just sign up on reactiveeducation.com/newsletter, and you'll get all of this in your email box on Friday. So you'll get the video from Wednesday where I give you the visual of the pie chart. And if you've seen us a lot, we love our pie charts. And one of the reasons I love a pie chart is that it's not fixed. So you have these categories and the sizes of the pie can change based on the individual person. This is where I think in post-concussion, It's not a one size fits all approach at all. You need to test out these different areas and treat each person individually, and not just treat each piece of the pie separately, but together as a whole, because it's the integrative function in the brain that gets impaired. And so if you only treat the visual symptoms, or only treat autonomic, or only treat balance, or vestibular, but not with the rest of the pieces of the puzzle, then you're losing that integrative piece, which is that functional connectivity piece that's involved in the post-concussion symptoms. So our pie chart includes several pieces of the pie that are really important indicators and key symptoms that we would assess and treat. So in the sensory system, we're looking at vestibular and visual, but all the other sensory systems, taste, hearing, smell, somatosensation, proprioception, we've got to test those all out as well. Vestibular and visual are usually the biggest that we see. In motor control, we're looking at a person's balance systems and how they respond to the environment. So again, testing, treating. Cognition has a big overlap with motor control because we look at attention and executive function. This is why we love having a neuropsychologist on our team to be able to help us sort through the cognitive piece that might be causing a lot of memory symptoms or brain fog and things like that. The other piece of the pie that our neuropsychologist helps us a lot out is teasing out the psychosocial or emotional piece that is involved in concussion. And lifestyle. So again, there's a nice little overlap here between neuropsychology and OT to dive into the lifestyle factors: diet, sleep, fitness and exercise routine, energy and pacing throughout the day, huge components in recovering from a concussion. So we've got sensory, motor control, cognition, lifestyle, psychosocial. Autonomic is a huge piece of the pie. There is so much literature coming out, and in fact, I'll link to this in our newsletter about some of these autonomic pieces that are being found more and more as disrupted after concussion and can lead to those persistent post-concussion symptoms, which is why, again, we need to test it and treat it. That overlaps a lot with the sensory systems, like the vestibular and visual system, because as I've talked about before, right, huge autonomic component into the way our pupils are controlled, for example. So again, we've got these like cornered into pieces of the pie and separated out, but there's a huge overlap in integrative function. Okay, so autonomic, really big. And then finally, we can't ignore the rest of the body. And the cervical spine as a really big piece of the pie in those persistent post-concussion symptoms, but the rest of the body too. So thoracic and lumbar spine, hips, pelvis, knee, ankle, shoulders, really it's all connected, and we've got to screen those physical impairments as well. Using the pie chart helps me a lot when I'm working with a person, maybe has a long history, a long story, a lot of neurologic involvement. And it helps me sort through and categorize and start to create sizes to the piece of the pie. And I will say the sizes of the pie pieces change too as we move along, but it helps me to know where to get started. So we absolutely use this pie chart as we set up an intensive program for people. And then we use it to test out and show recovery in those different areas as well. So hugely important. And we just put together this pie chart literally just this week with our team. So this is a really good segue into persistent post-concussion symptoms as a functional neurologic disorder, because when you look at the pie chart for this and you compare this to the pie chart for functional neurologic disorder, there is a lot of overlap from the sensory, the motor control, lifestyle, psychosocial, autonomic, the physical impairments, literally very similar categories, probably different sizes of the pie. But that was the first piece that really got me thinking of that. And I've been having conversations with colleagues about this as well. And when you look at the pathophysiology, which there's still so much to be learned in the concussion world about what's really happening in the brain, as our technology like fMRI gets better, we're able to understand this better. But we still don't know it all, I will say. We know there's metabolic dysfunction. We know that there's some axonal dysfunction, that the autonomic nervous system gets dysregulated as well, that there's changes in blood flow to the brain. We know this occurs, but still trying to understand exactly how that causes the symptoms that we see. Very similarly, in a functional neurologic disorder, we understand that it's not going to show up on our traditional CT, MRI, or EEG even testing, but there's positive findings on functional MRI imaging. And so there's a huge, that's like, those two go hand in hand for post-concussion symptoms and a functional neurologic disorder. Let me backtrack just a little bit, because you're like, maybe you're tuning in and you're like, wait, what's a functional neurologic disorder? So this is something we talk a lot about here, but let me just circle back to it if you haven't heard this term before. So a functional neurologic disorder is a neurologic disorder in which there's a problem with the functioning or connectivity in the nervous system, how the brain and the body are sending signals, receiving signals back and forth, rather than a structural problem. So connection problem versus a pure pinpoint structural problem. Now, it doesn't mean there's not structural issues happening, because when we see connectivity problems, in fMRI, we actually see that for some reason, these parts of the brains are over talking or under talking to one another, which would really cause a change in the brain structure, but not structural in that you see on an MRI a lesion in one particular spot. So that is a functional neurologic disorder. And that actually coincides very clearly with how people understand persistent post-concussion symptoms. You'll hear many neurologists, many researchers call it a functional, meaning connectivity issue in the brain that occurs after that head injury. And it makes sense that that would occur because your brain is getting bopped around in the skull, right? And so you're going to get a dysfunction in that connectivity. And I will point you to, by the way, if you use neurosymptoms.org, they updated their website. And if you go to neurosymptoms.org, you actually can't see it. So I'll put a link in our newsletter to the updated website, but they have a really lovely discussion there on persistent post-concussion symptoms. And I really love the analogy that they use that, after a mild traumatic brain injury, basically they'll say the volume knobs in some of the pathways in the brain, maybe in the brainstem and cerebellum, become turned up. So these pathways get turned up, maybe a little more excitable too. This is what we see in some of the metabolic and some of the neurotransmitter activity after concussion. They get turned up. So sensory pathways, vestibular pathways where we might get dizziness, pain pathways where we might experience pain and headache. Normally, our brain is very good about filtering out these sensations so that we can actually concentrate and use the ones that we need for the task at hand. But after a concussion, this process of filtering really goes wrong, and everything's turned up. And I don't know if you have ever used like a soundboard or you've been mixing music. If everything's turned up, it sounds terrible, and you can't make out one or the other very well. And it actually really leads to like a terrible musical experience. Don't do it. But this is exactly what occurs and what people experience after concussion and prolonged symptoms. The same analogy and same idea and connectivity issue is what is found in a functional neurologic disorder. And what I would say, because this is particularly what we see clinically at Re+active, is we see a lot of people who experience a functional movement disorder, or maybe 3PD, or another version of a functional neurologic disorder as part of their post-concussion symptoms. And we end up actually needing to assess that all at the same time and really treat it all. Again, you can't just treat the tremor that is occurring or just the dizziness without really integrating that into the whole body. So again, pie chart helps us out there. But you know, a large percentage of what we see in functional movement disorders is people who have gotten them post-concussion or post-multiple concussions. So I would really argue, yes, some of the things that we see in persistent post-concussion symptoms are indeed a functional neurologic disorder, meaning that they're due to a disruption in the functional connectivity in the brain to the body, body to the brain. And then the good news is that we can incorporate some of those same treatment strategies to help people with recovery. And I think there are a few key pieces that we need to be sure to include and screen and incorporate into treatment that are different than just a functional neurologic disorder. The cervical spine piece, the vestibular visual piece that just is more impaired after a mild traumatic brain injury. Those are two of the biggest pieces. But the sleep, the fatigue, the cognitive piece, the anxiety and fear associated with the symptoms, the dizziness, the difficulty with movement and changing postures and balance, and the autonomic nervous system, so many similarities and overlap with the functional neurologic disorder. So that's my argument. I would love to hear from you what you think as well. And there's a comment here. Thank you for explaining the functional disorder so well. There's a stigma associated with functional neurologic disorder, and your explanation takes the stigma away. It normalizes it. Thank you. Thank you for sharing that, Veronique, too, because that's what we see too. There is a lot of stigma, and I think that is embedded in kind of our medical model and some of the past understanding of a functional neurologic disorder, and it's time for us to move on. This is a really significant disorder that has a real cause, and that is explainable in the nervous system as a connectivity issue, and it is treatable. So Cheryl asked too, what type of doctor will you go to help with this? Great question. So I'll tell you the doctors I love to work with this. So if somebody is experiencing some movement difficulties, I highly recommend a neurologist who's a movement disorder specialist. And if more of the symptoms are cognitive, I highly recommend seeing somebody who's a neurologist, who's a concussion specialist, who also has neuropsychology on the team. So we have a neuropsychologist on our rehab team, but we work with an amazing group at UCLA who has, it's called the Brain Sport Group. They have a whole concussion team, and it includes neurology, they have pediatrics, they have neuropsychology, they have psychology, but a lot of that team-based testing is what helps to get to the bottom of what's going on. I also really love working with neuro-optometrists for a lot of the visual symptoms. Here's the bottom line. You want to get the diagnosis, absolutely, but for the treatment, it takes a team. It takes a team, and I think that team includes PT, OT, neuropsychology, your medical team. We work very closely with yoga therapy as well. Cheryl, do you know any doctors you would refer that are in the Dallas, Texas area. Not off the top of my head. I do know there's a great group at Baylor, which I believe is in Houston. I might be wrong there. I get off in my like Texas locations, but I think it also depends on whether the symptoms are movement based, so functional movement disorders like tremor and myoclonus and weakness, versus vestibular, visual, cognitive. So those would be different doctors that you might see. One would be a more concussion or even vestibular specialist. One would be a movement disorder neurologist. So Cheryl, I'll do a little homework and try to get back to you there. Thanks for asking the question too. And please reach out to me, sign up for our newsletter. By the way, our newsletter is geared towards therapists. I understand you might be asking questions for yourself or for a family member. You can join our newsletter anyway. You can reach out to me. We send our newsletter we send our newsletter out to patients every Monday, and we send it out to our colleagues, PTs and OTs in the field every Friday. I'll put a link in there. And yeah, great question, Veronique. New Zealand, I think, is what you're saying, what you're asking for here. And glad you have a great neurologist. At this time, not a lot of people are doing functional MRI as a diagnostic tool. It's not something that's outside of the research realm right now, unfortunately. So this is an area that needs to kind of, we have to catch up in the real world to the research world. So it's not really out there as a diagnostic tool, but a good neurologist can actually give you a very positive diagnosis and set you on the path of treatment without having all of that imaging as well. Great questions. I want to thank you so much for the questions, and thank you for joining me today. Again, if you're a PT or OT in this world, we've got a couple of great courses coming up, particularly for helping get started and understand with complex amount of symptoms. We've got our positive spin on dizziness course coming up on August 28th. And then we have a weekend course that is our ultimate functional neurologic disorders course coming up in October. So hope to see you at both of those. And thank you so much for joining me today. I hope you have a wonderful Friday, a great weekend, and I will catch you next week.